Welcome to this learning session on Biomedical Waste Management. Overview. In this session, we will discuss biomedical waste management, especially its classification, transportation and storage. The lesson summarizes all of the key components of biomedical waste management that are important for an IPC and AMR nurse to remember and adhere to. Learning objectives. By the end of the lesson, you will be able to define biomedical waste management, classify biomedical waste, general waste, and other waste into different color-coded categories, and explain in brief the process of transportation and storage of wastes in healthcare facilities. Biomedical waste management. Definition. Biomedical waste, or BMW, refers to any waste material generated during the diagnosis, treatment, or immunization of animals or human beings, or any research activities related to the production or testing of the biological or in health camps. Classification of healthcare waste. HCFs or healthcare facilities are responsible for the primary management of healthcare waste generated within their facilities and from activities undertaken by them in the community. HCFs, apart from the primary management of the waste they generate, are also responsible for its segregation, collection, in-house transportation, pre-treatment and storage, all before the waste could be collected by the common biomedical waste treatment facility or CBWTF operator. Therefore, for the proper management and handling of the waste in HCFs, the technical requirements and other aspects of waste handling are needed to be understood, adhered to, and practiced by each category of staff in accordance with the biomedical waste management rules according to the latest update. Waste that is generated from HCFs is classified as follows: biomedical waste, general waste, other waste. Biomedical waste. Let us now talk about different types of healthcare wastes in brief. Biomedical waste, or BMW, refers to any waste material that is generated during the diagnosis, treatment, immunization of animals or human beings, or any research activities related to the production or testing of the biological or in health camps. BMW includes all the waste generated from HCFs which can adversely affect a person's health or the environment in general if it is not handled and disposed of properly. All such waste is considered to be infectious and has to be managed as per the Biomedical Waste Management Rules of 2016. BMW consists of waste that has been in contact with the patient's blood, secretions, body fluids, infected parts, biological liquids such as chemicals, medical supplies, medicines, lab discharge, plastics, sharp metallic and glassware, etc. The Biomedical Waste Management Rules categorizes biomedical waste that is generated from HCFs into 4 categories. The categorization is done based on the segregation pathway and color codes. Various types of BMW waste are assigned to each one of the color-coded categories as listed below: yellow category, red category, white category, blue category. Color-coded categorization of biomedical waste. The table shown here displays the color-coded categorization of biomedical waste. Please pause for a while and go through the table thoroughly. General waste. General waste refers to all the waste other than BMW that has not been in contact with any infectious, hazardous, chemical or biological secretions and does not include any waste sharps. General waste mainly consists of dry waste, such as card boxes, newspaper and other plastics, plastic water bottles, aluminium cans of soft drinks, packaging materials, and empty food containers. Wet waste. organic or biodegradable waste, which mainly comprises food waste, construction and demolition wastes. It is to be remembered that general wastes are classified into dry, wet, and construction and demolition wastes and should be collected separately. Other wastes. Other waste consists of used electronic wastes, disposed batteries, and radioactive wastes that are not covered under BMWs. Other wastes must be disposed of as and when such wastes are generated as per the provisions under the e-waste management rules as per the latest update, Batteries Management and Handling Rules of 2001 and the rules or guidelines that are present under the Atomic Energy Act of 1962 respectively. Categorization and classification of wastes in healthcare facilities. Categorization and classification of wastes in healthcare facilities. The figure shown here displays the categorization and classification of wastes in healthcare facilities. Please pause for a while and go through the figure. Interim storage of biomedical wastes. Storage of biomedical waste as per the color code, type of waste, and color and type of container used for storage of waste. The table shown here displays the color coding and type of containers or bags that are needed to be used by HCFs for the segregation and collection of generated BMWs from the facility. This segregation has been done as per the Schedule 1 of the Biomedical Waste Management Rules of 2016. Please pause for a while and go through the table thoroughly. Interim storage of biomedical waste. The interim storage of biomedical waste is discouraged in the wards or different departments in healthcare facilities. If biomedical waste is needed to be stored on an interim basis in the departments of healthcare facilities, it must be stored in dirty utilities or sections. It is to be ensured that no biomedical waste should be stored in the patient care and operation theatre areas. If dirty utilities or sections are not available in the healthcare facility, then biomedical waste must be stored in a designated place away from patients and traffic. In-house transportation of biomedical waste. The in-house transportation of BMW from the site of generation of waste to the interim storage area to a central waste collection center must be done in closed trolleys or containers that should preferably be fitted with wheels for easy maneuverability. The trolleys or carts that are used must be designated only for the purpose of collection of BMWs. Patient trolleys must not be used for the transportation of BMWs. The trolley's size to be used depends on the volume of waste generated from the healthcare facility. Summary. We have reached the end of the topic. Let us summarize. Biomedical waste refers to any waste material that is generated during the diagnosis, treatment, or immunization of animals or human beings or any research activities related to the production or testing of the biological or in health camps. Waste generated from HCFs is classified as biomedical waste, general waste, and other waste. The BMWM rules categorizes biomedical waste that is generated from healthcare facilities into 4 categories, which include the yellow, red, white, and blue categories. All healthcare staff should familiarize themselves with the classification of different types of healthcare waste, the color coding system that has been assigned to each type of healthcare waste, the interim storage and in-house transportation of different types of healthcare wastes.